And the cost of health insurance seems to keep going up, and now another increase could be on the way for more than 500,000 Pennsylvanians who get coverage through the state's Obamacare marketplace.
Yeah, tonight, Erie News Now's Mark Soliday is here in the studio for this story. And Mark, you talked to a healthcare expert today, an industry expert, about what to expect come January. What did you find out?
Well, I guess you can expect a higher premiums for one thing if this all goes through. You can also expect an end to the tax credits that really have been helping low-income Pennsylvanians afford healthcare coverage. That's been going on for years, but there is a way to make your voice heard on this issue. Pennie is the state's online Obamacare marketplace. It's supposed to be the spot where Pennsylvanians who don't get health insurance through work, Medicaid, or Medicare can turn for affordable coverage. New word out of Harrisburg is that starting in January, those premiums could go up, with insurance companies asking for hikes close to 20% on average. So, who will it impact? Dr. Amar Rawari talks health policy on his podcast called Value Health Voices.
Oftentimes older individuals in Pennsylvania who right now don't qualify for Medicare. It may be people who are in rural areas who have less choice in their insurance options. And when these rates will increase, it may force them to drop coverage.
Rawari says it'll be a double hit, rising premiums coupled with the end of federal tax credits to help pay for them.
For example, let's say a 60-year-old couple earning about $82,000 in York County could see their premiums jump from about $586 per month to about $2,800 per month, which is almost a 5 times increase in their premiums if these subsidies are to expire.
And Rawari says the impact of this double whammy will trickle down to everyone.
More people get kicked off of insurance because they can no longer afford these premiums than to allow for, people to still get coverage and hospitals and providers to still be able to provide good coverage. Hospitals increase rates, to compensate for some of that. So it can affect everybody, even people who are insured.
And we did mention that there is a chance for you to make your voice heard on this issue. The state is actually taking public comments as part of the review process for these insurance rate hikes. So you can make that voice heard through an email. The address to do that is ra-in-comment@pa.gov. Dr. Rawari says these comments can actually make a difference. They'll be accepted right up through September 2nd. Mike Kneva?
All right, Mark.